Hello, everybody. My name is Keisha Greaves, and I'm the CEO and founder of Girls Chronically Rock clothing brand. My pronouns are she, her, hers. And for a quick description, I'm a Black woman with short pink hair, could be a different color next week. I have a lot going on in my background with words, fashion, clothing, all the stuff hanging from the ceiling as my background view. I live with limb-girdle muscular dystrophy, and clinical trials, clinical resources are important to me is because I was diagnosed with muscular dystrophy in 2010 when I was actually in graduate school. I was in my early 20s. So it was kind of something that came out of nowhere where I would just be walking, my leg would give out on the floor. But I honestly just thought maybe I needed to lose weight. I thought no big deal. So getting testings like MRI, muscle biopsy, EKG, echocardiogram, you name it. That was the results of neurologists calling me saying I have limb girdle muscular dystrophy. So I totally didn't know what my future hold, what was going to happen, because I'm like, I never heard of it. And so, like most of us, we run and we go to social media, and I'm reading muscular dystrophy, and I'm not reading such great things. Like, there's no treatment, there's no cure. So I'm just like, what does my future hold? I want to be a fashion designer. I want to be an entrepreneur. So I felt like my whole world totally shut down. But over some time, I did come out of my shell with connecting and networking with other people on social media that have muscular dystrophy like me, that have a disability like me, that are a Black woman like me. And that made me feel good because I'm like, look at them, they're doing it. And I've connected with a whole new range of a support group on Facebook for people that have limb girdle muscular dystrophy. And I was so excited because I went to a conference in 2019, right before the pandemic hit, and it was in Chicago. And they had researchers, doctors, and I specifically had a conversation with one of the doctors, like, it's so disappointing. I want to be able to enter a clinical trial. I'm the type like I don't care being a guinea pig. I'm like, how do we know what's gonna work unless we try it? I just thought, hey, you have something like to try out, let me try it. If it's a pill I need to swallow, a shot I need to take, because how would we know if we can't move forward to make a cure for this muscular dystrophy? Because to this day, they still don't even know how it came about, how someone gets it, or anything. The only treatment is physical therapy. But yeah, I think that clinical trials, I mean, I'm hoping some progression happens soon. I'm hoping there is a way to I can enter a clinical trial without knowing my subtype and anything like that. But this is why it's so important for clinical trials for me to I feel like with resources to help not just me but people in the disability community that have not just muscular dystrophy or lupus, cancer, anything like that. But with muscular dystrophy, it's been going on for so many years and there's still no cure, still no treatment. So that's why these clinical trials are so important. And so I'm always willing to be a guinea pig to say, hey, let's try it. I just hope things get better and we find some kind of cure or treatment. But that's why it's so important for these clinical trials to occur.